Welcome, I'm Bruce Munro, and with me is International Relations Specialist Professor Robert Patman, and this is Global Insight. People sharing beds in hospitals desperately short of oxygen, makeshift funeral pyres as deaths top 200,000. The COVID pandemic in India has become an international emergency. Welcome, Robert.
Morning, Bruce.
India is in desperate straits, but there has been an immense international response to that need. Is this something new?
Well, first of all, the desperate state is absolutely true. 300,000 new cases of COVID each day for the last 6 days and rising in India, and hospitals in India are under enormous pressure with life-saving oxygen in ever shorter supply, and some patients cannot get admitted to hospital and dying literally outside. So yes, I don't think we can understate the scale of the problem, and it's overwhelming not just the hospital service but even the arrangements for funerals. So India is facing a major crisis, and yes, there has been a major international response. For example, the United States has lifted its ban on vaccines, has got 30 million vaccines, the Oxford AstraZeneca vaccine, and probably make that available very shortly. But the United States is also making available raw materials for vaccine development and ventilators and oxygen. And the UK, France and Germany are all helping with ventilators and oxygen. And as we've heard, New Zealand has also now contributed $1 million to the Red Cross. The Red Cross is working with the Indian government on these much needed oxygen supplies and also medical supplies.
Is this a sort of response that we have seen for other disasters, or is there something different about this one?
Well, we've seen acts of great generosity when other countries have encountered natural disasters. Viewers with long memories may recall events like the Ethiopian famine in the mid-80s, when people gave incredibly generously, and music bands got together and organised fundraising activities. So human beings can act very generously when the needs are great, and the needs are very great in India at the moment. This is the second surge of COVID-19 that India has experienced, and I think it's close to overwhelming the country, and there is quite a lot of, I think, bitterness and recrimination in India at the moment that the Modi government, which is a populist government, has not been focused enough on this problem. And I think some Indian politicians believe that although this is a great challenge for any government, it's been made greater by the fact that the Modi government has in some ways gone about business as normal. Festivals have gone on, virus spreading events have gone on, and now we're seeing a perfect storm.
New Zealand has been criticised for not acting quickly enough to help India. What is New Zealand's track record on helping others during this pandemic?
I don't think that criticism is particularly fair, because New Zealand in December of last year made available vaccines for the 3 Pacific territories, which is part of the realm of New Zealand, and also extended vaccine coverage to 3 Polynesian states if their governments want this assistance. In addition, New Zealand has made more than 10 million available to the key multilateral agency for the equitable distribution of vaccines, which is COVAX. So that's the key multilateral mechanism, and New Zealand has said it will do more, both in the Pacific and in India, and also, if necessary, with COVAX. So I think it's a bit unfair to say we, haven't been done enough. I think New Zealand, like many countries, has been taken aback. Remember, we've had the experience of managing COVID-19 in quite a disciplined fashion in this country, and we've had no internal transmission recently of COVID-19. And other countries are being, and we saw this in the United States, absolutely ravaged by it. And India, unfortunately, is now really under the gun. And I think, hopefully, the international community will rally round.
In what ways do you see that COVID is changing international relations?
Well, COVID-19 is a crisis where no one is safe in New Zealand or any other country unless everyone is safe in the world. So it's bringing home to us our degree of interdependence, both within societies and across societies, between states. And I think it's a disruptive event, and I think the new normal is going to be redefined. The world is not going to go back to the pre-COVID-19 world. Exactly what that world will look like is difficult to predict, but I think international relations is being profoundly redefined by COVID-19. I think science is back. People realise how crucial experts are, healthcare professionals. And those countries that have done relatively well during the COVID-19 crisis are those countries that listen carefully to scientific and healthcare advice and acted accordingly. I think one thing that's quite clear is that COVID-19, although it's a disruptive event, it's not a one-off bruise, because all states are now confronted with events which do not respect borders. COVID-19 is the most spectacular example of a challenge that doesn't respect borders, and is forcing countries to cooperate to a level they probably hadn't anticipated out of self-interest alone. But I think it's going to set a trend. We're already seeing that many people are sensitised to, and governments are sensitised to the need to finally accelerate efforts to deal with the biggest threat of all, which is climate change. And Mr. Biden, the US President, has indicated that quite very ambitious targets for reducing carbon emissions. And I have a feeling that public opinion is moving in that direction now. But climate change is one, if you like, it may be a beneficiary of COVID-19. I think people become sensitised to the problem. And I think other areas of policy making, in the economic realm, the security realm, in the healthcare realm, I think people are also going to be looking at much greater cooperation in the future. This may not happen, immediately, but I think COVID-19, a disruptive event, will change international relations as we know it.
Thank you, Robert.
Thank you.
And thank you for watching. Catch us next time on Global Insight. Ka kite anō.